From KETK, you're watching East Texas Live.
Welcome back. Joining us now today is Dr. Christopher Couch, and we're going to be learning more about the ECMO program. How are you doing today?
Doing good. Thanks for having me, David.
Yes, sir. So what is the ECMO program?
Yeah, so ECMO stands for extracorporeal membrane oxygenation. That's just a fancy term for extracorporeal, outside of the body. Membrane oxygenation is an artificial lung, which essentially we have right here. It's a membrane oxygenator that takes carbon dioxide out of the blood and then infuses oxygen back into it. We couple that with a pump, centrifugal pump here, that essentially can pressurize that pump, and depending on where we put these large bore cannulas inside the patient's blood vessels, can support either the lungs and or the heart as well.
Yes, sir. What's the value of having something like this here in East Texas?
So ECMO is used for a lot of different conditions. I mean, this is a heroic life-saving procedure. And so for lung applications, it can be patients that have really bad pneumonias. And obviously we're coming into cold and flu season here in East Texas and beyond. So that's an important modality that we can have for patients that are on really high levels of mechanical ventilation, the breathing machine support. And doctors at other facilities aren't able to manage these patients further because there's really nothing else they can do. ECMO allows us to take a lot of the workload that is happening with a breathing machine, a ventilator, and actually use the ECMO itself to provide that oxygenation that that patient needs. For cardiac applications, it can be anybody that has cardiogenic shock, meaning that their heart pump is not going so well, okay? So it can be patients that have a big heart attack, patients that have blood clots in their lungs, pulmonary embolism, patients that have overdosed from certain substances, and so on and so forth. And so it allows us to be able to rest those vital organs and provide good blood flow to the brain, heart, lungs, while we try and either get the patient to recover from their illness or bridge them to other types of support, whether it be transplant, implantable pumps, and so forth.
Yes, sir. And with respiratory illness season coming up, can you tell us more about how this is used for flu and COVID season?
Yeah, so like I said, what ends up happening is when patients get ill, obviously they'll go to the doctor initially, may start off slowly, and they'll get antibiotics, antivirals as appropriate, maybe some steroids to try and help with that lung inflammation. And then as that disease worsens, they're likely going to have a hard time with oxygenation. And so we'll give them supplemental oxygen at any medical facility. And if they get to the point where they're still struggling to breathe, we'll go ahead and put them on the breathing machine, a mechanical ventilator. Okay, so that's the stuff that you see all the time in traditional hospitals. What ends up happening though is as the lungs get diseased and stiffened because of all the inflammation, the ventilator has to work harder and harder to open up those stiff lungs, and that causes injury in of itself. And we know that after a few days of being on the ventilator, on high levels of the ventilator, that injury can become so significant that the patients won't survive. So our hope is to really get these patients on ECMO if they're an appropriate candidate. There's a lot of different nuance to this, but be able to support them within the first few days of being on the ventilator to be able to wean them off that ventilator and then also wake them up, get them moving around. One of the other nice things that you see with these ECMO patients is that while they're being supported with their lung function with these cannulas and with this oxygenator, we can wake the patients up, take the breathing tube out, and actually you'll see them walking around the unit. One of the things that we know is it's not just about surviving that condition, but it's also rebounding from it. And so if the patients are awake, moving around, doing aggressive physical therapy, all of those things to get them better, they've got a much better chance of not only surviving, but actually going home rather than having to go somewhere else where they linger in a bed for several months if they do recover.
Yes, sir. And real quick, where can people get more information on requesting something like this?
So our website actually has our FirstCom Transfer Center information, so they can call for that. And this is going to be the medical providers. And so if you have a patient or a family member that you think would benefit from this, or you've heard about this, talk to your provider, and then they can go ahead and try and call UT Health East Texas's Transfer Center and put in a patient referral request.
Yes, sir. Well, Doctor, thank you so much for coming in.
Hey, thanks. Appreciate you. Take care.
Sir, for more information, go to the website right there on your screen.